Good morning. My name is Jay Lieberman, and I'm chair of the Department of Orthopedic Surgery of Keck Medicine of USC. Today's topic is prevention and management of rotator cuff tears. And with me is Alex Weber, one of our sports medicine specialists. Alex, obviously everybody knows has heard of a rotator cuff, but can you tell our audience what a rotator cuff is?
Sure. So the rotator cuff is a series of 4 muscles and tendons that surround the ball and socket joint of the shoulder. These tendons and muscles are very important for moving the shoulder, especially in athletic activities with overhead motion and daily activities.
So when a patient has a rotator cuff problem, how does it normally present? How do they know that they're having a problem with the rotator cuff? Because they generally will just say, I have shoulder pain.
Sure. So there are some very specific clues for rotator cuff injuries of the shoulder. Patients typically present with pain over the lateral or outside part of the arm. That's a classic finding for rotator cuff injuries. They also present with pain with overhead activities and pain that wakes them up at night. So if you're experiencing those symptoms, this location of the arm, the outside part of the arm, pain with overhead activities and pain that wakes you up out of sleep at night, this is likely a rotator cuff injury.
Excellent. So in addition to a careful history and physical exam, are there any imaging studies that help you make the diagnosis?
So with many orthopedic injuries, we always start with x-rays in the office when we're evaluating the shoulder. However, ultimately, we typically use MRI, magnetic resonance imaging, to identify a rotator cuff tear.
And is the MRI sensitive enough for you to pick up different size tears?
Absolutely. So we like to use the MRI because it's our most sensitive and specific test for diagnosis of a rotator cuff tear.
Okay, so if the patient comes in and they're complaining of the symptoms that you described, what's the first mode of treatment?
So with many things in orthopedics, we always like to start with non-operative or conservative care. For rotator cuffs, that includes physical therapy and occasionally injections.
And what do you mean injection? What kind of substance or agent are you using for the injection? And what's the goal of the injection?
That's a great question. We recently actually have published a study looking at injections in rotator cuffs, and there were some interesting findings. So typically we use corticosteroid injections for musculoskeletal injuries. These injections help decrease inflammation and decrease pain. However, they're short-acting. And what we found is we looked at our rotator cuff tear population across the country, almost 500,000 rotator cuff tears. And what we found is those that had injections prior to having rotator cuff repair, or if they needed surgery, they would then have a higher re-tear rate if they had an injection prior to surgery. So this has really changed the paradigm a little bit for us. We use injections still if they're needed or if someone needs some short-term pain relief. However, we do think that steroid injections prior to rotator cuff repair may diminish the outcomes for that patient. So aside from corticosteroids, we do have some other options. More and more we're using PRP or platelet-rich plasma, which we think is a very strong anti-inflammatory. It can help our patients in the short term with pain relief and functional improvement. And it doesn't have the deleterious or negative side effects that steroids do in terms of causing re-tears following surgery.
Excellent. What's the role of physical therapy in the conservative management of the rotator cuff tear?
Yeah, there's definitely a role for physical therapy early on in rotator cuff injuries, especially those that are not a full thickness tear of the rotator cuff. If there's partial tearing or wear and tear to the rotator cuff, this is a good opportunity to use some physical therapy, strengthen the surrounding musculature, and improve the function of the patient. Importantly, it will not heal the rotator cuff tear or wear and tear, but it will allow the patient to use the surrounding muscles to improve their workflow in daily life.
And when conservative management has failed, what are the operative options for the patient with a rotator cuff tear?
Yeah, the beginning steps to this are to decide whether the tear is partial thickness or full thickness. In partial thickness tears, sometimes just a debridement arthroscopically, which means camera surgery through small poke holes, we're able to create more space and remove the inflammation around the rotator cuff. This gives our patients a quick return to full activities. If there's a full thickness rotator cuff tear, now we're talking about repairing that. It's similar to sewing a shirt button back to a shirt. We're able to sew the rotator cuff back to the bone. We're able to do this arthroscopically, meaning with small poke holes around the shoulder.
And what's the recovery from a rotator cuff repair? How long does it take for the patient to get back to normal activities? And I assume that physical therapy is going to be necessary also.
Absolutely. So after a rotator cuff repair, we typically have the patient in a sling just for 1 to 2 weeks. We've become more aggressive about our physical therapy protocols. Therefore, after a few weeks, the patient comes out of the sling and starts working with a physical therapist. We expect in 6 weeks' time, they get their range of motion back. At 3 months, they start strengthening with a plan to be back to full activities at 6 months following arthroscopic rotator cuff repair.
And what percentage of patients can return to overhead activities? Suppose it was a tennis player.
Yeah. So with a small full-thickness rotator cuff tears, we expect 85 to 90% full return to activity. And that means tennis, golf, even rock climbing or overhead activities, which put tremendous force on the shoulder. Fortunately, we've looked at our group here at USC, and we have phenomenal recovery and outcomes, closer to 95%. So with arthroscopic techniques and our newer techniques here at USC, we're able to get our athletes and our weekend warriors back to all activities.
Well, that's terrific. We hope you've enjoyed this session on rotator cuff repair. Everything you ever wanted to know about rotator cuff repair. I think Dr. Weber provided a very detailed discussion of the issues related to rotator cuff tear, and he's clearly an expert on the topic. We look forward to seeing you again on Facebook Live in the future. Have a good day today.
Have a good day.